hormone replacement therapy is one of the most effective ways to restore hormonal balance in both male and female people. And it also has many more other benefits that we're about to find out about from Dr. Mark Opperman, who's from the T Clinic. Mark, welcome back. So we've started our discussion on hormone replacement therapy for men, but let's dive into some of the particular benefits that could be associated with this kind of therapy.
Michael, I think we can characterize them or categorize them in 5 big groups. So the first one is mental wellness, physical wellness, sexual wellness, self-esteem, and ultimately all of those combine to give us quality of life.
Right.
So if there's a change in any of those, I always ask my patients to score them out of 10. How good is your mental well-being?
Yes.
And if it's starting to decline, that's where you can have benefits from hormone optimization or balancing.
So let's dive a little bit deeper. We'll start with the mental benefits that we're going to look at. I mean, first of all, when you say mental decline, what kind of decline are you talking about? And then how would this kind of therapy help to either reverse or repair, or at least stop or slow down that deterioration?
So in that category, I would give you, number 1, cognitive functioning. And this is where we look at memory and brain fog. I add to that higher function, motivation, concentration, drive, focus. I want to add to those the ones that's involved in sexual behavior, in other words, libido, which is sexual thoughts and fantasies, and even sex drive, which is the frequency with which you want to initiate or engage.
Right.
All of those are functions of the brain. And then the mental aspect, and here we start looking at things like mood swings, increased irritability, depression, anxiety, etc., etc. So the role that, for instance, your thyroid hormone has on energy metabolism in the brain is quite crucial. We can look at the role of cortisol on stress, that if it's prolongedly elevated, it's going to start leading to, firstly, anxiety, later depression, and then when your cortisol levels drop because of adrenal fatigue, it starts leading to disengagement, not only from the people around you, but also from yourself.
Right.
Testosterone, on the other hand, is a wonderful, wonderful psychoactive hormone that works on another neurotransmitter or chemical messenger called dopamine. Now, dopamine is responsible for motivation, reward, repetitive behavior. So it elevates, and when we do something that's nice, dopamine elevates. And because it's nice, we want to repeat it. So it becomes a repetitive behavior because there's a reward at the end of it. So testosterone, for instance, work well on that one. It's important to note again that these things are interrelated to one another. So it's a well-known fact that we have something, for instance, called the gut-brain axis. So if your gut is unhappy, if you feel queasy, etc., etc., it has an effect on your emotional state.
Yes, yeah.
So, there's fine balances and effects that we take into account.
Absolutely. So let's move on. I mean, but also, again, we're going to demonstrate another link here, I'm almost certain, because we're going to talk about the physical benefits now. And you've just mentioned the impact of your mental cognitive function, the depression, anxiety, whatever that might be, which might cause you to disengage. So physically, there are going to be changes as well. But before we get there, give us an overview of the physical aspects of benefits.
The benefit of hormone optimization on physical well-being would be maintaining muscle, maintaining bone health, the prevention of that middle age spread in both men and women. It helps us with the retaining and preventing cardiovascular disease, so it protects us against that.
Yes.
There's the effect that it will have on energy metabolism in itself, which gives you that go
Yes.
and continuous well-being from a physical side. It's as we get older, muscles become weaker, bones become more brittle, and that leads to injuries. In episode 1, we referred to the diseases of aging, hypertension, diabetes, elevated cholesterol, those kind of things. So it protects us against those diseases. It can even reverse those diseases. So from a physical perspective, I would classify it as that.
Okay. Sexual is the next one, and we've touched on it in the first one, but let's go deeper into the sexual aspect of, or the benefits to your sex life when it comes to hormone therapy.
Balancing of, let's take a step back. As hormone levels start declining, which they do from our early 30s in men, there's a decrease in libido and sex drive for a lot of men. And that's probably one of the first things that we start noticing is, from a sexual perspective, I'm just not performing as well as I'm used to. It has a good and a profound effect on blood flow. So for men, if we look at the plumbing part, we need to get blood into the penis, which is a sponge tissue.
Yeah.
We need to get the blood in as well as out to maintain erections. If we don't have a good erection, it has a psychological effect. Most erectile dysfunction is because of psychological issues, not specifically because there's a problem with blood flow to the penis. I want the guys to realize that erectile dysfunction or problems with erection is very often the first sign of an underlying disease.
Okay.
Either whether it's elevated cholesterol levels or diabetes, et cetera, et cetera. So if you are starting to battle with erectile functioning, please consult your doctor. Don't ask for one of your prescription medications. I just can't get it up.
Yeah.
Ask him, I can't get it up. There must be something underlying.
What is the cause?
Can we go and look for this?
Yeah, absolutely. I think it's interesting, as you say, it's one or two bad experiences then creates a mental cycle, which then becomes a bigger problem.
Absolutely.
But if you take action, if you have the struggle, the hard,
Yes.
or the difficult situations,
Yeah.
figure out what it is, understand what it is, because we can't just put a Band-Aid on that one.
Yeah.
Next up, you mentioned self-esteem, and this is a big one as well, because, I mean, again, it goes to cognitive and mental, but it has
Absolutely.
such a big impact on your life as a whole.
You know what, Michael, where I realized the effect that hormone balancing, specifically the use of your sex hormones, testosterone, has on self-esteem is when my executive patients came back to me and said to me, you know what, I'm not doing anything different, but people are relating to me differently when I walk into a boardroom. I walk into a social environment and there's a change. Women approach me differently. My friends, my guy friends, stand back and listen and look and take me seriously. So, and that has a profound effect on how we see ourselves.
Absolutely.
That image that we have in our minds is so much different to the one that we see in the mirror.
Yes.
So you often see these really good-looking guys with low self-esteem where they don't value themselves. Optimal hormone balance changes that in a lot of cases.
Right. So, Mark, we're pretty much out of time, but finally, quality of life was the last thing that you mentioned there. And I guess when you collect all of these things, the benefits collectively are going to give you that quality of life that you may not have had for some time.
Absolutely. Michael, what I do with my patients is to dumb it down. I say to them, if you can answer, or if you answer yes to any of your following questions, has there been a change in sexual performance and behavior? Is there a change in my cognitive function? Is there a change in mood and mood stability? Higher function, motivation, etc., etc.? Am I seeing changes in my weight and my sleep? You can benefit from hormone optimization. when we improve these things, ultimately we improve our well-being,
Absolutely.
which improves our quality of life. And that's all that we want is
Exactly.
I want to enjoy my life. It doesn't matter of all the wonderful blessings that I have around me, but I want to enjoy them. So I want to have a good quality of life.
Absolutely. Mark, anyone looking to get a bit more information or dig deeper into this, how can they get hold of you? Remind us.
Easiest, internet, our website's www.petitclinic.com. Branches, Umhlanga, Johannesburg, here in Bryanston. Call us on 010-824-1393.
As always, such a pleasure to find out more about this wonderful therapy. Thanks so much, Mark.
Thank you.